Good afternoon, everybody.
Good afternoon.
Anyway, I'm Stephen Pollack. For those of you who've never met me, I pretty much know everybody except our new members. And I have a different kind of talk today. The first thing I want to talk about is gratitude. And my own gratitude for my family, my wife, my great dog, my friends, my occupation that I was blessed with at an early age of 16. I knew I was going to be a chiropractor at that time. And it's been a dream come true, and I've been able to live out my mission. And it's never been a job. It's just always been fun, and I feel blessed to, have found my calling that early. I also have gratitude for having a healthy life, the abilities to play my sports, travel, and leisure. And I have gratitude for being a member of the OCBA, 25 years. Not the oldest yet, there's quite a few that have been here longer. But I've made amazing friends and business relationships, and I'm thankful for all of them. There's never a day in my office where I'm thinking of how I can refer somebody to the OCBA. Patients ask me everything about everything, who does air conditioning, who does lawns, who does this. So I'm always thinking about the OCBA because they've been so good to me, and the relationships have been excellent. What I've learned in 46 years of being in practice is pretty interesting because I've dealt with all kinds of people's shapes and sizes, and I've treated over tens of thousands of treatments for patients over the years. And one of the things that I've discovered is that illness and disease are founded by fear and lack of faith. And that goes for physical and emotional health. We fear the unknown and create illusions of the worst scenarios of what symptoms might be caused in us. The media, internet, gossip, bad medical advice, past history distort and interfere with the true nature of our conditions. We relate to past emotional and physical traumas and scars, and it interferes with our present time existence. We are saddled with fears in the past future. And the other thing is we've lost faith in our body's natural abilities to heal. We have a culture dependent on drugs and surgery as an external means of maintaining our health. We live in a toxic environment, especially in New Jersey. Our food, our water, our air is tainted with poisons and toxins, so we find alternatives to combat our toxic environment with more toxic drugs, pills, creams, surgeries. The second problem is that we are so far removed from being in tune with our bodies, we've lost faith in this amazing machine that we have. Do you ever think about having to have your heart beat or to breathe every breath, every second of every day? No, you have to feel that creating a wound after you've cut yourself. We have an amazing living organism that is self-healing. I'll give you my favorite example. You're in a whiplash injury or a trauma. Within 24 hours, your body is developing a matrix of collagen and healing elements to patch up that irritated tissue. And the other thing it's doing is releasing serotonin and endorphins to kill the pain. So without even thinking about it, you're healing, and you don't even realize it. So many of the patients that come in that have trauma or a whiplash injury, I tell them, you know what, right now you're in shock, your body's secreting all these natural painkillers, and you don't even know what's wrong with you at this point. And it isn't until weeks or even months later that the actual expression of that injury is demonstrated. So we always give that talk to somebody in a trauma. And a lot of people, I don't want to go to the emergency room, I don't know. The other thing as a chiropractor, the more that this scar tissue or fibrotic tissue is developing to heal whatever soft tissue or even bony tissue that's damaged, the thicker it gets, the less movable it is, and it's harder to adjust that patient. So we always suggest that for anybody here, or family members or friends, you should get adjusted immediately after an injury because it's going to make it so much easier for us to work with you. And that's for any joint in the body. So the body can heal itself from any condition. In my 46 years, I've seen patients that have faith and lack of fear and they heal from every condition you can imagine. Just by having a positive outlook, having faith not only in themselves, but whatever the healing doctor that's helping them, and believing in that. I've seen, you can name it from AIDS to cancer to any condition. In my 46 years, I've seen people healed from everything just by their change in their framework of what they feel. It's all in your perception of how life is. And we see people that are just positive and upbeat, and they seem to just enjoy life more because they're in the moment. We are so distracted by our past life existences, and it's not easy to get over. Don't get me wrong, we love to undermine ourselves. Even when things are going good, we run these dialogues in our head that are just undermining to our health and happiness. So with practice, with meditation, with yoga, with just understanding, hey, that was appropriate for me when I was a child, when I almost drowned or I was abused. And that's why I go into a corner and I'm quiet and I'm scared to go swimming, etc. But as an adult, we tell ourselves when we're in these same episodes or experiences, they're not appropriate. And you can get better. So I have a feeling of abandonment because of my parents going through divorce. But every time I have a fight with my wife, which is not ever, and or I have someone upset with me, that feeling comes on. But now I've learned to say, that's just because I had that in the past. And it helps me move on. But as far as physicality, we hold on to our physical irritations too, and we can still heal from them. And that's where we get locked up. And I see it in every individual that we have these things don't allow us to express living in the moment. So what we do as chiropractors is I work with your nervous system. And the nervous system controls and coordinates every cell, tissue, and organ in your body. And that's where I love being a chiropractor, because as we help the nervous system, it helps your emotional, physical, and chemical well-being. And it balances, and it allows you to get away from some of these stressors that you've been carrying with you your entire life. So many times, it's not even the physical adjustment I give to a patient, it's just listening to them and having someone to understand what's truly behind their ailments. Many people come to me and they'll say, I got this neck pain, I got the weight of the world on my shoulders, I got shooting pains down my arms, my fingers, and I can see that they're not giving me eye contact. I'm also certified in neuro-linguistic programming, which Roger Lee's taught me. So I can see eye contact when they don't have it, and I say, what's really bothering you? They go, well, I'm going through a divorce. So there's always some underlying or combination of physical, emotion, and chemical problem that creates your lack of enjoying life to its fullest. So when we give adjustments to the spine, and I work on every joint in the body, it releases the nervous system, which controls all these tissues in your body, and it expresses yourself close to 100%. And yes, sometimes we can help people in a couple, but many times it takes 3 months to compensate for a lifetime of holding these stressors in your life. So the sooner you get in after initial injury, or even after you've had prior injuries at accidents, auto accidents, trauma, sports injuries, it's never too late to improve yourself. And it's never late to improve yourself mentally and emotionally, and physically and nutritionally. So what services I offer? I do chiropractic for all ages. I was one of the first chiropractic pediatric doctors in the country, and I still love working with pregnant moms, newborns, babies, autistic children, special needs kids. I get more joy because they don't complain, and they're always happy after we adjust them. And kids are great, they, even though they can't even speak sometimes, they just love to jump on the table because they know the difference. They feel the energy is different after they've been adjusted. We work on elderly, we work on, for some of our patients, some of our fellow OCBA members. We do sports chiropractic pretty much I worked on professional athletes for almost every type of sport you can imagine. And they're a lot sometimes harder because their muscle tissue is so dense on some of the bigger guys. But range of motion and improvement in every sport. And for a runner, for instance, getting an adjustment, having your nervous system being that much better is the difference of a 0.2 seconds to win a race. So having that nervous system function helps you be more alert, more focused, etc. We do personalized nutrition for weight loss and for just overall health. We do exercise programs that are fit and once more customized to what you can do. We do spinal decompression, which I'm proud to say I was the first one to ever bring it to the United States. I worked with the inventor of it, and we've treated hundreds and hundreds of patients that would have otherwise had surgery that are now, did not have surgery, and they're still doing great to this day. So we do that for cervical discs, lumbar discs, and it's painless and works. 80% of the people get totally better. We do neuropathy treatment. Then if you have tingling, numbness, malfunctioning, be able to balance with your feet, it can be in the hands, it can be in the facial area, but we work mostly with the feet. Very common with diabetic neuropathy, people that had chemo with cancer, they get a lot of neuropathy. They respond better because they've only had it recently, so it doesn't take as long to regenerate and renew those nerve endings. We do smoke cessation with microcurrent acupuncture. I've been doing that for almost 30 years, and we've helped hundreds of people to stop smoking on one treatment. Regenerative medicine, which I took on about 10 years, which is stem cells and plasma-rich protein, which is called PRP injections. I've kind of cut back on that. We really only do family, friends, and people that we know. But I work with a nurse practitioner, and stem cells are the future. It's the answer to healing degenerative joints without surgery. I've done my own knee, my own ankle, and they were horrific from 60 years of basketball and tennis, and they're like new again. So I swear by that also. It's highly regulated, the stem cells, and it's, for some reason they really give us a hard time, but it's very regulated, but we're still able to do them here. Countries like Costa Rica and Colombia, I've sent patients there for more serious types of stem cell, for MS and Parkinson's, only to come back fantastic. So there's solutions out there without drugs and surgery. Don't get me wrong, I don't want to tell you that I don't believe in drugs or surgery. They absolutely have a place. They save people's lives, but by all means, you want to exhaust every natural potential way to heal yourself, because you have that ability. And the last thing I do is motivational speaking. I've been doing a talk called Laugh Yourself to Health for over 25 years, and I never charge for it, and we've done hundreds and hundreds of these talks. So if you have a group or a large employee volume, it's a great team building element, and the whole purpose of the talk is to let you know that every day you wake up, you can choose to have a good day or a shitty day. It's totally up to you. It's all how you perceive life that day. And lastly, I want to say that I'm honored and privileged to serve my community. I'm also thankful for the career that I love and consider most of my patients' family, and always be proud of. The biggest criticism that I have is that I love my patients too much. That's it.